All right, Dr. Henderson talking about our next subject, our next surgery, which is going to be for urethral strictures or scarring in the urethra. There's different ways to take care of this. So we're specifically going to be talking about the Optilume procedure that's on the market right now, or a DVIU. DVIU stands for direct visual internal urethrotomy. All this is minimally invasive through the urethra. We're not doing any big cutting or anything like that. When you have a stricture there, there's a couple ways you can take care of it. So that's what we talked about today. One of those that's newer on the market, and I'm sure they'll have some other ones out after this video, but it's called Optilume, and it's just a balloon that blows up. And so if you have a tight little scar tissue in your urethra here, that balloon blows up and dilates open the scar, and then it has this anti-scarring medication on the outside that kind of permeates into the tissue there, so that when it goes to scar back down again, it doesn't. So it's a very new, effective procedure. We've been doing some of this stuff. If you look at my other videos with the bladder neck, they're coming out with a new balloon for that, like a 10-minute procedure or less. The worst part about any of these procedures is you go home with a catheter, and that's to allow everything to stay open and to heal. We usually get that catheter out in 3 to 5 days after that specific procedure. They've seen that you can actually use that Optilume anywhere along the urethra except in the bladder neck and prostate. So they're making up new balloons for those. Those should be out shortly on the market, and I'm sure a lot of urologists will use those as well. Other things we can do without this fancy balloon device is the DVIU, or direct visual internal urethrotomy. All we do is just make an incision through that scar tissue. When we do that, it pops wide open. We put the catheter there and try to let it heal with the catheter inside. When we do that, you have about a 50% chance that that's going to scar back down. Sometimes we teach guys how to do self-dilation to keep dilating open the scar tissue. Other times we now are reverting back over to the Optilume procedure because it has a higher success rate, about a 70% success rate of preventing that scar from coming back. We can even use that balloon at the meatus, or the opening of the urethra, which is a common place for us to get scarring. If you're not using the balloon, we do what's called a meatotomy, where we kind of clamp the tissue to crush it to stop the blood flow going through there and literally just cut it. Sounds like the worst thing ever, guys, but it works very, very well. We do it on little boys as well. And it just keeps that open so that you can urinate, so the flow keeps going, so that you don't have any obstruction. With any of these, I would anticipate probably wearing a catheter for anywhere from 3 to 7 days, depending on how we do the procedure. They're all good procedures. They're minimally invasive. You won't see any big cut marks or anything at all, and wouldn't even notice it. And a little blood or something after the procedure is all you really have to plan for. Once that catheter comes out, you can go back to your normal workout routine or your daily activities and shouldn't have any issues.